Encouraging news from the CDC saying, according to a study, Omicron has a 53% reduction in symptomatic hospitalizations. There is also a 74% lower risk of being admitted to the ICU. Most importantly, the risk of death is 91% lower, and exactly 0 Omicron patients had to be put on a ventilator. Some hospitals are still feeling the strain from the surge, so let's go to our chief national correspondent, Matt Gutman, inside a hospital in Burbank, California.
We are in a training space here in a hospital that is filled with patients. Its sister hospital has tents outside the ER to handle the volume. And all of this is compounded by staffing shortages across the country, so severe here in California that the state has ordered all of its healthcare workers back to work if they're COVID positive but asymptomatic. Morning amid an explosion of COVID cases nationwide, that stunning new data showing the risk of death from Omicron is 91% lower than the Delta variant. The Kaiser study out of Southern California also revealing a 53% smaller risk of symptomatic hospitalization compared to Delta, 74% less risk of ICU admissions, and not a single one of the 52,000 Omicron patients in the study required mechanical ventilation. But with the U.S. averaging more than 750,000 new COVID cases a day, many hospitals are overwhelmed. In Sacramento, first responders frustrated as patients wait 8 hours outside hospitals for beds to open up.
They essentially have to just stand there and wait, sometimes 8 hours for a bed to transfer their patient.
Tents set up in LA area hospitals.
We have nurses out there, we have our registration secretaries, and we have doctors out there that are seeing patients wherever they can, because the true physical space of the ED is completely full.
Some medical workers begging for people to stay home unless it's a real emergency. The spike triggering staffing shortages, with California now ordering COVID positive healthcare workers who are asymptomatic to report back to work.
You think about it, it's insane. And
It's insane.
It is insane, and it's unethical.